Question for the entire panel, actually. Are any of you aware of anything in the field of holistic medicine or acupuncture that perhaps might have some promise, something worth trying?
Yes. Oh, sorry. Yes. So the question was about holistic medicine and acupuncture. She has a microphone. You could hear her. I didn't have to say that. So I'm going to start with acupuncture. Actual trials in multiple sclerosis published with acupuncture, placebo-controlled trials. How do you do a placebo-controlled trial with acupuncture? You send half the people to an acupuncturist, the other half to me, and I just put needles in them. They think they're seeing an acupuncturist, but I'm like, that looks like a good spot, and put it in. The people who went to a real acupuncturist had a significantly better response than just me jabbing them, and you would expect that. But in my hands, I don't know for the other folks, I'm batting about 50-50. So when I refer my patients with chronic pain or tingling to an acupuncturist, I'm getting about 50% of my patients coming back and saying, that helped. Now, the question in my mind, and I haven't figured out a way to answer this, is for the 50% it's not helping, is that patient-dependent or practitioner-dependent? Do I need to start asking them, well, try a different acupuncturist? Or do they have a biology that's just not responsive? I don't know the answer. So what I recommend is if you have pain issues, numbness, tingling, and you have not tried acupuncture, I personally say it is absolutely worth a try. Rule number one, you need to go to a licensed practitioner. Each state generally has a board that will license acupuncturists. You should stick to the group that is licensed because there is an oversight board for them.
I was actually asking for cognitive issues.
For cognitive. So I don't know the data. You got the data for cognition?
I don't have any data, but I can tell you that the National Institutes of Health has a Center for Alternative Medicine, and I would look on that website, try to see what studies they're funding, because those are what the government at least views as the most highly likely to be successful. The other thing is that Hopkins, there's a person named Susan Courtney who does research on cognitive changes in MS, specifically in women. And so you might look her up as well. She has several studies that have been published on at least identifying factors that are important for this, not necessarily giving you a lot of choices of how, or options on how to fix it. But at least that's a start.
And then, although this may not be exactly the same thing as what you are referring to as holistic medicine, there are a whole host of Chinese-based exercises that might fall into that, like Tai Chi and some of the other forms of balance exercises that have been promoted to show, have been shown to increase balance, especially in the elderly population. And although I haven't seen any articles about cognitive benefits, I wouldn't be surprised if there are cognitive benefits for some of these other Oriental exercise modalities.
So, shake it, Pauline. Keza's getting loose under there. So the other thing, just a couple things that I always think is worth mentioning in this context is, number one, these holistic medicines. You know, a lot of people, I've had patients come in and say, you know, I don't want to take those drugs. And then they've got a list of nutraceuticals that they're taking, which is like 30 pills. And these are drugs. They are drugs without any question. You know, St. John's wort is the #1 prescribed antidepressant in Germany, over Prozac, over Zola. So these are drugs. They're not as well regulated. They're not as well controlled, but they have effects. They're just drugs, and it's important to remember that. I think that they have real effects, and I think they can be very effective. I think you have to be careful because you can take them unmonitored, and then you can get into, you know, into a tight spot. The other thing that I think is always worth mentioning is that you do want to beware, you know, family members recommending things, because sometimes it sounds great, like, oh, you've got an autoimmune disorder. Here's this great pill that's really good for the immune system. And that's the last thing you want, is something that's going to boost your immune system, right? That's going to make it worse. And so, for instance, in lupus, I know at Hopkins that Michelle Petrie does not like echinacea or melatonin, right?
Yeah, yeah.
I'm sorry, so I should say Dr. Birnbaum does not like echinacea or melatonin. Why don't you just address? So, you know, you have to be
Yeah, I mean, he's right. A lot of these medications, and I think, Doug, you mentioned this in TM, but echinacea, which is actually given. So the last thing you want is a medicine that's actually going to, cause the immune system to become overactive. So for any patient who has any autoimmune disease, I think one of the things we need to say is, we want to not take echinacea because that could actually be detrimental. And the problem with a lot of these medications that fall under the rubric of holistic medicine is that they're not reviewed by the FDA. But the fact that they're not reviewed by the FDA doesn't mean that they don't contain active pharmaceutical ingredients which could either be beneficial or deleterious. So echinacea is definitely out, and we even say alfalfa sprouts, and there's probably a whole list of medications in holistic medicines that are actually deleterious and could cause.
How do we access a list like that of what to be aware of?
That's the problem and I think this is the challenge that the FDA does not really regulate a lot. So, my advice would be if you're not exactly sure what's in these medications, don't take it.
Dr. Birnbaum's home phone number is. It stimulates the immune system.
Yep.
By the way, I'm not telling you that these are, the right medicines and the right interventions are great, and you have to find what works for you. And exercise is easy to recommend because the side benefits are wonderful, as well as what we know of it in many different respects. And again, St. John's Wort is used as a great antidepressant here in Germany. So I'm not saying that they're bad. You need to find what works, but you do need to be careful about sort of if you're going to go that way. Like if you're going to be a vegetarian, you need to know how to get the right balance of amino acids. If you're going to go that way and use that as a treatment, you just need to do your research and make sure. You don't want to do something like bee stings where there's a 1 in 100 chance of anaphylaxis. But on the other hand, acupuncture, my insurance company strangely won't pay for my wife to go get a gynecological exam once a year, but they will pay for acupuncture. So that would be certainly, very reasonable. Although I think, Ileana, that if you're going to go acupuncture, you might as well throw some Botox in there and get rid of wrinkles and all of that. Not for you. She's a dermatologist, I'll tell you. So she knows what she's doing here.
And actually, one last question. We've come across many programs that offer PT, OT, and actually just a few that offer the cognitive therapy. And coming from a community that you'd think would have quite a few options, we're in Miami, a large city, Miami, Florida, and there are actually very few options for just strictly cognitive therapy. Anywhere where I could go to other resources other than the local physicians for finding other options for that?
So this is a major issue, actually. So a gentleman, physician Pablo Selnick at Johns Hopkins, is head of our comprehensive outpatient neurorehabilitation program, where they're a third, PT, OT, and cognition. One of the tricks we run into is actually an insurance issue. It turns out that if you have only cognitive needs, insurance tends to say we're not going to cover it. But if you have physical therapy and cognitive needs, they tend to cover both. It's a strange little snafu we run into. So part of it is trying to justify, once you find access, once you find the right place to go to, trying to justify the coverage. I'll tell you on the cognitive side, speech therapists will do a lot of the evaluations and a lot of the therapy in terms of how to deal with cognitive issues. So looking for a good speech-language pathologist is a place to start. The other thing is there are a lot of books written, and we've kind of adapted from the dementia literature, and this is all anecdotal. I don't have good data from MS or ADEM, which would be where it's an issue here. But just like we rehab legs, so just like if I have someone go to Frank or Kathy to work on gait, and they're doing repetitive exercises over and over and over and over and over again, if you talk to the speech-language pathologists, that's kind of what you need to do for cognition. So you need a formal evaluation to try and define where the problem is. Is it auditory learning, visual learning, multitasking, spatial memory, mathematics? Where's your problem? and then you pick a routine that stresses that issue over and over. So if you're a multitasking, math-deficient individual, you should get a bunch of Sudoku puzzles and 30 minutes a day, do Sudoku. If you are I can't find the right word for that language difficulty, you should have a stack of crosswords next to you 30 minutes a day. It sounds silly, but just like you're going to exercise a leg that isn't working, the best general advice we could give without specifics on the individual would be figure out what your deficiency is and then push the limits. Keep pushing yourself to try it, and it's repetition. There is no cognitive rehab where you're going to go into a program for 3 weeks and come out thinking better. This is something that happens over months more than anything else.
I just wanted to add that another trained professional to deal with this is a neuropsychologist. And another thing to do, if you contact wherever you're living, if there's a comprehensive rehabilitation, in-house rehabilitation, you can contact them and say, I just wanted to know about outpatient services, and they may be able to direct you to someone who does this on an outpatient basis as well. Do you want to add?
Yeah. And we're also saying to make use of available resources and don't reinvent the wheel. Cognitive issues are a big deal in the traumatic brain injury population, and there's a lot of resources available through the associations that have been set up for brain injury rehabilitation. So I think if you Google brain injury rehab, or if you look and see what the local traumatic brain injury center is in your area, you're going to find plenty of individuals there who deal with cognitive rehab and cognitive therapy.
Thank you. Well, Dr. Yang, who gave us a presentation on the bladder, is not here, but I thought maybe one of you experts could answer my question. I understand that TM causes incontinence. Now, if a vasectomy can be reversed, my question is, can this incontinence be reversed?
You want this one? Who on the panel went to the bathroom last? I think it was Doug. No. So the spinal cord injury / transverse myelitis in the bladder. So in general, when we're talking about bladder dysfunction in the spinal cord, we, I think, can be very successful at keeping people dry. So there are a lot of weapons in our armamentarium to keep people continent, meaning avoiding accidents and avoiding leakage. We stink at getting people to go when they have an inability to void. So if the issue is I have a problem emptying my bladder, then we are still stuck somewhat with self-catheterizations. There are bladder stimulators that are out there that, to be honest, I have not been overly impressed with. Either they don't work when they go in, or over a 2-year period, they phase out in terms of their working. So they might be great up front, and then 2 years later, we can't figure it out, but we're back to square one. And it's hit or miss. So I have yet to be bowled over by the bladder stimulators. So if the answer is keeping dry, there's a long list, and it tends to be medicines and a bladder regimen. So after spinal cord injury, and I think this gets to, I think Kathy mentioned this and Frank mentioned this, a lot of the stuff from spinal cord injury is applicable here. Part of this is getting into a regimen, trying to retrain bladders. So it's like I'm doing potty training with my girls right now. And so it's in the morning. I don't care if you have to go, you're going to sit. And you're going to sit there until something happens. Part of this is retraining the body. And so for the bowel and the bladder, we try and promote specific regimens. For people who are in between especially, so for somebody who comes in and says, I self-cath sometimes, and not all the time, that's kind of music to my ears, because I'm like, all right, there's a shot, because that means there's a signal getting through. At some point, there's a signal getting through. So now it's a point of trying to maximize how do we get through. We're not always successful, but you can give it a try. If the problem is leakage, though, there's a long list of either medications or bladder regimens you can use to try and keep dry.
Have you seen any success with diaphragmatic
No.
Yeah. Yeah, let me just. I was just going to comment that the $500 per vial was a real bargain compared to what it costs here. But, oh, really? Okay. Well, I guess we're charging too much. There are a number of urological surgical procedures that can augment the bladder if that's the problem, and there are a number of very specific procedures that the surgeons can do on the sphincter itself. So it's not just the bladder; it's the outlet from the bladder, which is the sphincter, which could be either too loose or too tight. So basically, you need to find out what kind of bladder problems you've got. Are you holding, is your bladder large and floppy, or is it small and irritable so that it can't fill up? And once you get that, once you're categorized into one of those classifications, then I'd ask your urological surgeon, are there augmentation techniques that would work if it's a small irritable bladder, or are there sphincter techniques that can work? And when you listen to the urological surgeons talk about this amongst themselves, there's quite a variety in success. And surgeons always have their favorite operation depending on past success or past failures. There's also the issue of a learning curve. And you'll see that with using botulinum toxin to treat urological problems, both to the bladder itself or to the sphincter, depending again on what they're trying to use it for. And the experience that I've had talking to urologists is, they're very interested in doing it, and I think the European urologists have just had more practice doing it. And what I suspect is that it's going to become more and more popular here because so they'll get more and more. Exactly, and they'll have more practice. Practice, practice, practice.
Can I add something before we move on? As a minor note to this, we do have pelvic floor muscles that also, if you can strengthen, can often ease some of these problems as well. And you can look that up online. You can ask your physical therapist about it. And basically, the pelvic floor muscles, you can tell if they're working by testing it. And when you're urinating, sort of start and stop. And that's the control of those particular muscles too. So, that's right. Right, and to keep in mind that this isn't the common physical therapy, so you may have to look around a little bit more to find someone who has training in these kinds of issues. But there are people that do that. It's just not that common.